When we talk about women's healthcare and the obstacles that women are facing in terms of accessing women's healthcare, we tend to talk about it in a very superficial manner about the practicalities, but we so seldom speak about the crux of the issue, which is actually this shame that is imposed on women and that actually acts as one of the biggest hindrances, because historically there's been the stigma around the female body, the female anatomy, especially the female reproductive system, and only as of recently we've been unpacking this and empowering women to exercise their autonomy. But a lot of women don't even understand this concept of autonomy, which is on a fundamental basis about women having the power to decide what happens to their bodies, but it's also about women being able to harness the power to take care of their bodies. How do we even get to that point if a lot of girl children in African households are raised to be very hush-hush about things like menstruation, to feel ashamed when they're menstruating, that they can't even ask questions about the changes that their bodies are undergoing as they grow into their womanhood. And a lot of women are still battling things like body dysmorphia because of the societal expectations of how the female body should ideally look like. How African women especially have been taught that their bodies are simply vessels for childbearing, but anything else that goes wrong is shameful and is for them to hide and not speak about openly. All of this affects our health-seeking behavior, is what we call it in medicine, which is basically someone feeling comfortable enough to seek and access healthcare services that they need.